is just absolutely critical, and keeping track of exactly when the money arrives, plus understanding all these shifts in the system, well, it can get confusing.
Yeah, definitely. So our mission today is really to cut through some of that noise. We want to pull out the essential info, figure out what's actually happening with payments this month, and unpack these important changes that could affect a lot of people. Okay, let's dig in.
Let's do it.
So the first thing that kind of popped up in the reporting, maybe causing some head scratching, is about the June 2025 payment schedule. Why did some folks getting Social Security not see a payment land in their account this month?
Yeah, this is a really common point of confusion, actually. It specifically impacts the roughly 7.4 million people who receive Supplemental Security Income, that's SSI, or people who are dual beneficiaries. So they get both SSI and regular Social Security.
Okay.
If you're in one of those groups, you might have looked at your June statement and thought, hey, where's my SSI payment?
But it wasn't actually missed, it was just early. Is that right?
Exactly. It's not missed at all. It's an early payment, and it's because of a long-standing rule the Social Security Administration, the SSA, has for SSI payments.
Okay, what's the rule there?
So SSI payments are normally scheduled right for the first day of the month. But, and here's the key part, if the first happens to fall on a weekend or a federal holiday, the payment gets sent out on the very last business day of the previous month.
Ah, okay. So looking back at June 2025, June 1st was a Sunday.
That's it. June 1st, 2025 was a Sunday. So following that rule, the SSI payment that would normally land on June 1st was actually issued on Friday, May 30th, which means, no separate SSI payment date was technically scheduled within the calendar month of June itself.
Got it. So the money arrived just earlier than usual, but I can see how that could definitely throw off someone's budgeting.
Oh, absolutely. I mean, the total amount you get over May and June doesn't change, but getting that payment right at the end of May means you've got a much longer gap until the next one hits your account. Requires careful planning.
Mm-hmm. And when does the schedule kind of snap back to normal for SSI recipients?
It gets right back on track in July. The next SSI payment is scheduled as normal for Tuesday, July 1st, 2025.
Okay. And I noticed the reporting also laid out the rest of the SSI schedule for 2025, which seems useful given these shifts.
Yeah, it's helpful to see the pattern. So after July 1st, you've got August 1st, then August 30th, which is actually the September payment landing early.
Ah, another early one.
Right. Then October 1st, October 31st, that's November's payment, December 1st, and then December 31st, which is technically the payment for January 2026.
Wow, okay.
So you see that pattern, right? 2 payments in some months, none in the next month, all because of that weekend holiday rule.
Okay, it clears up the SSI situation.
Yeah.
But what about the, the regular Social Security benefits? Retirement, disability, SSDI, survivor benefits. Is their schedule affected in the same way?
No, those follow a different system entirely. It's mostly based on your date of birth. For most people getting those types of benefits, their June payment arrived on a specific Wednesday.
And how does that break down?
Okay, so if your birthday falls between the 1st and the 10th of any given month, your June payment was scheduled for the 2nd Wednesday, June 11th.
Okay.
Birthday between the 11th and the 20th, 3rd Wednesday, June 18th. And if your birthday is later in the month, from the 21st to the 31st, your payment should have arrived on the 4th Wednesday, June 25th.
Was there anything about people who've been getting benefits for a really long time, like an exception?
Yes, good catch. The articles did point that out. Anyone who started receiving their regular Social Security benefits before May 1997, so quite a while ago, they're on a different schedule. Their June payment actually came earlier, on Tuesday, June 3rd.
Interesting. Okay. And just quickly, for anyone listening who might be unsure, what exactly is SSI again? How's it different?
Sure. SSI, Supplemental Security Income, it's a needs-based program. It provides monthly cash to people who have very limited income and resources. A and D are either 65 or older, or blind, or have a qualifying disability. It also covers children with disabilities.
Right.
The income limits are pretty strict. According to the sources, for an adult, wages generally can't be more than about $2,019 a month. And you can apply online, by phone, or at a local SSA office.
And what does the SSA generally recommend to make sure payments arrive smoothly? Any tips?
Well, they always push direct deposit. It's faster, safer, avoids meal delays. And they really encourage everyone to set up and use their online My Social Security account. That's at myssa.gov. You can see your benefit statements, your payment schedule, update some info. It's a good tool, especially for tracking these early SSI payments.
Okay. And the big question, what if you were expecting a payment on one of those dates we mentioned and it just didn't show up?
Right. Well, first, if you still get paper checks, which is rare now, like less than 1%, the SSA says wait 3 extra mailing days.
Okay.
But for the vast majority who get electronic payments, if it's not there after, say, 3 business days past the scheduled date, that's when you should definitely reach out. Call the SSA's main number, 1-800-772-1213, or contact your local field office. Don't just wait.
Good advice. Okay, so that covers the sort of calendar quirks for June. But let's shift gears. There's another major change the reporting flagged, something that could actually require millions of people to physically go into Social Security offices.
Yes, this is a really big one, separate from the payment dates, but potentially affecting a lot of beneficiaries. It's about changing your direct deposit information.
Okay, how has that process changed? What's new?
So as of April 28th this year, if you need to change the bank account where your Social Security benefits are deposited, maybe you've switched banks or something, and you can't do it through your online My Social Security account, you might now be required to visit an SSA office in person to get it done. They need to verify your identity face-to-face.
And what does can't do it online mean in this context? Like, who falls into that group?
Well, the online system, My SSA, has beefed up its security. It often requires you to get like a one-time code sent to your phone to confirm changes you make online, or even if you call them.
Right.
So if you don't have a smartphone, or maybe you don't have reliable internet, or you're just not comfortable navigating websites, which, let's be honest, applies to many older or disabled beneficiaries, or if, for some reason, your bank can't automatically update the info with SSA through their system, then you could be looking at a required trip to the office.
Okay. And what's the SSA's rationale here? Why this change?
Their stated reason is fraud prevention. They've reported seeing what they call a marked increase in allegations of direct deposit fraud since 2023. They put in those enhanced security checks for phone and online changes, and apparently, just between late March and late April this year, those checks flagged over 20,000 attempted changes where the person couldn't verify their identity properly.
Wow.
And here's the interesting part the SSA highlighted. A really high percentage of those flagged attempts, somewhere between 61% and 72%, were never resubmitted. The SSA views that as a strong sign that many were likely fraudulent attempts that got stopped. They estimate they avoided nearly $20 million in potential losses just in that short period.
Okay, so from the SSA's perspective, it's a necessary security measure.
Yeah.
But the reporting also brought up a pretty strong counter-argument from advocates, right? Like the Center on Budget and Policy Priorities, the CBPP.
Exactly. Advocates like CBPP argue that while, yes, fraud is a concern, this in-person requirement might be an overreaction, especially considering the potential scale of the specific phone-based fraud it's meant to stop. Some analysis, based on agency comments, suggested maybe around 800 phone fraud cases over a whole year.
Just 800.
That was one estimate discussed. So advocates question whether that number justifies creating what they see as a massive burden for potentially millions of legitimate beneficiaries who just need to update their bank info.
And that burden does sound pretty substantial. How many extra people are they expecting to have to visit offices now?
The SSA's own estimates, according to the report, suggest this change could drive nearly 2 million additional people into local offices every single year just for direct deposit changes.
2 million. Wow. And why is making an in-person visit such a big deal, particularly for the Social Security population?
Well, think about who relies on Social Security, right? It's largely seniors and people with disabilities. The articles really hammer this point. Many in this group simply don't have internet access, or they aren't tech savvy.
Beyond that, you've got significant physical barriers. Data cited shows roughly 6 million seniors don't drive at all. And another 8 million or so older Americans have health conditions or disabilities that make traveling even short distances really difficult or impossible.
Yeah.
So telling someone they have to come into an office isn't just a minor inconvenience for many, it can be a real hardship.
And that CBPP analysis on travel times you mentioned, that really drove the point home.
It really did. Their research found that nearly a quarter, 25% of seniors live more than an hour's drive away from their closest Social Security office.
An hour each way.
Likely, yeah. And half of all seniors live at least 33 minutes away, and that's without traffic. CBPP estimated this policy could force beneficiaries to spend over 1 million extra hours per year just traveling to and from SSA offices.
That's staggering. And didn't they identify specific states where this travel burden is even worse? Yes, they did. Their analysis pinpointed several states, mostly more rural or sparsely populated ones, where over 40% of seniors face that hour-plus drive. That list included Arkansas, Iowa, Maine, Mississippi, Montana, Nebraska, North and South Dakota, Vermont, and Wyoming.
Right.
And then there's another big group of states where between 25% and 39% face that long drive, states like Alabama, Alaska, Arizona, Georgia, Idaho, Kansas, Kentucky, Minnesota, Missouri, New Mexico, North Carolina, Oklahoma, Oregon, Tennessee, West Virginia, Wisconsin, Virginia. Quite a few.
So a widespread issue.
It seems so. Now, it's fair to note the SSA hasn't independently validated CBPP's specific travel time data, but the underlying issue of accessibility is pretty clear.
And this surge in required office visits is happening just as SSA offices are already feeling squeezed, isn't it?
That's a critical piece of context and a major part of the criticism. The reporting points out the SSA has actually cut its workforce by about 7,000 employees over recent years. Yeah, so you have fewer staff in the field offices trying to handle the existing workload, leading to longer waits for appointments. SSA's own data currently shows that less than half, only 43% of people trying to get an appointment for benefits actually get one within 28 days.
So fewer staff, potentially millions more people required to come in, and already long waits. That sounds like a recipe for frustration, maybe even gridlock at local offices.
It certainly paints a picture of potentially overwhelmed offices, yes. The sources also mentioned that the SSA had initially considered an even stricter policy limiting people's ability to even apply for benefits over the phone, but they backed off on that after pushback. They narrowed the restriction just to these direct deposit changes, unless you can do that online verification.
Okay, so we've got the June SSI payment timing quirk, and now this new potential hurdle for changing bank info. Let's shift again. There's another set of policies starting up again that could actually reduce the amount people receive in their monthly checks for totally different reasons. This is where things get really interesting.
Yeah, these policies involve the federal government resuming certain debt collection efforts, and Social Security benefits can, in some cases, be garnished or offset to repay those debts.
And the first big one mentioned was student loans, affecting Social Security.
That's right. One significant policy that's back in action under the current administration is the garnishment or offset of Social Security benefits for people who have defaulted on their federal student loans.
How much can they actually take from a benefit check for that?
The rules allow them to take up to 15% of your monthly Social Security payment. And a really crucial detail here. That 15% is calculated based on your gross benefit amount that's before things like your Medicare Part B premium are deducted.
Oh, wow. Okay.
However, there is a protection in place. The law says that even after the garnishment, you have to be left with at least $750 per month from your Social Security benefit. They can't take you below that floor.
It's still kind of surprising how many older Americans are dealing with student debt.
It really is, and the numbers cited are quite high and growing. The data showed something like 3.6 million people age 60 and older still owe federal student loans.
Wow.
And the group directly hit by this garnishment policy, those 62 or older who are actually in default, that number was around 452,000 people. And this isn't just retirees. It can affect people on disability or survivor benefits, too, if they have defaulted federal loans maybe from long ago, or even parent PLUS loans they took out for kids.
Okay, so that's one group facing potential reductions. What was the other major collection effort that's being stepped up?
The other one is the push to recover Social Security overpayments. This happens when the SSA realizes it paid someone more benefits than they were actually eligible for.
How does that happen?
It can happen for lots of reasons. Sometimes it's an error by the SSA itself, maybe a calculation mistake, but often it's because a beneficiary's circumstances changed. Maybe their income went up, or their living situation changed, or their disability status improved, and they didn't report that change promptly to the SSA, so the payments continued at the old higher rate for a while.
And the scale of these overpayments, it sounds like a lot of people are affected.
It does seem significant. The SSA's own data indicated over 1 million people were identified as having been overpaid in fiscal year 2022 alone, and almost another 1,980,000 in fiscal year 2023. So yeah, there are potentially millions dealing with this kind of debt owed back to Social Security.
And the policy for getting that money back, the recovery policy, that's changed recently too.
Yes, and this caused quite a stir. For several years, including under the previous administration, the standard practice was to recover these overpayments by withholding no more than 10% of a person's monthly benefit check.
Okay, 10%.
Right. But earlier this year, there was a signal from the current administration they might revert to a much older, harsher policy allowing for withholding up to 100% of the benefit, basically taking the whole check until the debt was paid.
The whole check.
Yeah, that triggered a huge outcry, as you can imagine. Thankfully, that plan was revised around March or April of 2025. The new default policy for recovering overpayments is now set at withholding 50% of the monthly benefit.
50%. That's still a massive jump from 10%.
It's a huge jump. While it's not 100%, going from a 10% default withholding rate to 50% is a major change for the estimated 1.5 million Americans who currently owe money from overpayments.
And didn't the notice period shrink for these overpayment collections too?
Yes, that's another really critical and potentially difficult change. The reporting indicates that before the pandemic, beneficiaries usually got about 65 days notice before the SSA started withholding benefits for an overpayment.
Okay.
Under the current policy, that warning period has been slashed to just about 30 days.
Only 30 days. That's not much time to react or make arrangements.
Not at all, especially if you need to gather documents to dispute the overpayment or request a waiver or a different repayment plan.
So if you put these two resumed collection efforts together, the student loan offsets and the stepped-up overpayment recovery,
You're looking at a pretty large group of people potentially seeing their monthly Social Security checks shrink, maybe unexpectedly. You've got the roughly 452,000 older borrowers defaulted on student loans, plus that estimated 1.5 million dealing with overpayment debt. That's close to 2 million Americans who could be impacted by these involuntary reductions.
and for people living on fixed incomes, often relying solely on Social Security, even a 15% reduction for student loans, let alone a 50% hit for overpayments, that could be financially devastating.
Absolutely devastating. The reports mention that while recovering overpayments might save the SSA system something like $7 billion over 10 years, the immediate impact on individuals can be incredibly harsh. These benefits cover basics, rent, food, medicine. Taking a big chunk, especially with costs rising, pushes people into really desperate situations. Budgets are often already razor thin.
Yeah. Okay, so we've covered quite a bit. The June SSI payment calendar quirk, the new hurdles with in-person visits for direct deposit changes, and now these resumed debt collection efforts for student loans and overpayments.
Right. It really paints a picture of a complex landscape right now for beneficiaries, doesn't it? Multiple different things happening that could affect their payments or how they interact with the SSA.
Definitely. So let's try to boil this down. What are the absolute key takeaways someone listening should really walk away with from all this information we've unpacked?
I think the main point is be aware that there are specific, distinct reasons why your Social Security payment might look different or why you might face new requirements. It's not just one single issue you need to understand. Does the SSI calendar shift affect me? Could this new direct deposit rule impact how I make changes? Do I have defaulted federal student loans or an outstanding overpayment debt? Knowing which category you might fall into is step one.
And who really needs to pay the closest attention right now?
Well, clearly, anyone receiving SSI needs to track that payment schedule carefully. Anyone who anticipates needing to change their bank information soon, especially if they don't have easy online access or a smartphone, should be aware of the potential in-person requirement. And crucially, anyone with defaulted federal student loans or anyone who has received notices in the past about a Social Security overpayment needs to be vigilant.
Okay, so if someone is listening and thinking, uh-oh, this might apply to me, or maybe they get a notice in the mail tomorrow, what actionable steps do the sources recommend they take?
The absolute number one piece of advice stressed over and over is act quickly. Especially with that shortened 30-day notice period for some garnishments, you cannot afford to wait.
Right.
If you get a notice, contact the SSA immediately. Call the 1-800 number, 1-800-772-1213, or get in touch with your local office. If it's about student loans, you'll likely need to contact the Department of Education as well.
Okay, what else?
Ask questions. If you're facing garnishment, ask about setting up a repayment plan you can actually afford. Ask if you might qualify for a hardship waiver. There are provisions for that, especially with overpayments, if repaying would cause severe financial difficulty. Keep checking your online My Social Security account if you have one, and scrutinize any letters or statements you get from the SSA. And if you feel overwhelmed or unsure how to proceed, consider reaching out to a reputable nonprofit financial counseling service. They can often help navigate these situations.
That urgency really seems key, especially with those shorter timelines.
It's absolutely critical. Ignoring a notice or delaying your response can just make things worse, potentially leading to larger amounts being withheld without you having had a chance to arrange something more manageable.
So, wrapping this all up, what does this deep dive really tell us? It feels like it highlights just how complex managing Social Security benefits has become. It's not just a simple check in the mail anymore.
I agree. It shows beneficiaries have to navigate everything from predictable, if sometimes confusing, calendar shifts to potentially major administrative hurdles for basic tasks like changing bank info, and now also face the renewed risk of benefit reductions due to debt collection policies that can, themselves, change quite rapidly.
It really underscores the reality for the millions who depend on these benefits, doesn't it? Their day-to-day financial stability is directly linked to these sometimes quite technical operational decisions and policy shifts happening within the SSA and the wider government.
It's their lifeline.
And maybe it leaves us with a final provocative thought for everyone listening. Think about that inherent tension we've seen here. On one hand, the SSA has a responsibility to protect the system, prevent fraud, make sure benefits go to the right people, which protects all of us.
Right.
But on the other hand, the methods used to achieve that, requiring potentially burdensome in-person visits, implementing aggressive debt recovery, can impose real hardship on the very seniors and disabled individuals the system exists to support. How do policymakers in the SSA find a better balance? One that stops fraud effectively but doesn't create impossible barriers or push vulnerable people over the financial edge.
Yeah, that's the multi-billion-dollar question, isn't it? Finding that balance is incredibly difficult, but incredibly important. Definitely something to keep in mind as you check your own situation.
Something indeed. Rachel, thanks for walking us through all that complexity.
My pleasure, Paul.
And thank you for joining us on Financial Area for this deep dive. Welcome to Financial Area. I'm Paul.
And I'm Rachel.
Today, we're doing a deep dive into Social Security benefits. We've looked at a whole stack of recent news and reports focusing on payment schedules and some pretty significant policy changes that are, hitting recipients right now.
That's right, Paul. For millions of Americans, Social Security is just absolutely critical. And keeping track of exactly when the money arrives, plus understanding all these shifts in the system, well, it can get confusing.
Yeah, definitely. So our mission today is really to cut through some of that noise. We want to pull out the essential info, figure out what's actually happening with payments this month, and unpack these important changes that could affect a lot of people. Okay, let's dig in.
Let's do it.
So the first thing that kind of popped up in the reporting, maybe causing some head scratching, is about the June 2025 payment schedule. Why did some folks getting Social Security not see a payment land in their account this month?
Yeah, this is a really common point of confusion, actually. It specifically impacts the roughly 7.4 million people who receive Supplemental Security Income, that's SSI, or people who are dual beneficiaries. So they